And thanks for joining Catholic Charities for another virtual parenting education session. We're so excited that you've chosen to be with us today. So today's topic is actually one that doesn't get talked about nearly enough, but is really important for the health of mothers and babies. So this afternoon, we're going to be talking about birth spacing. So give me just a moment, and I am going to share my screen with you so that we can get started on our topic of birth spacing. But before we do that, I do want to jump right in with a little bit of a disclaimer. While we are very educated on the topic of birth spacing here at Catholic Charities through our work that we do with our Moms Empowerment Program, where we help pregnant women through their pregnancy as well as the baby's first year of life, we are not medical providers. And so this disclaimer is just to let you know about that and the resources that we use and how we want to provide you this information in a timely fashion. But there may be some inaccuracies that we do apologize for. So on that note, let's get started. So what is birth spacing? It's something that you may or may not have heard about. So we want to talk about that, but there are also risks associated with having your children too close together and challenges just being a parent dealing with children close in age. We want to talk about the timing as well as what you can do to help plan successfully for your next pregnancy. So those are the things that we'll be discussing in the next few minutes together. So birth spacing, what is it? Some people refer to it as pregnancy spacing. If you're doing a Google search in the medical field, it's referred to as inter-pregnancy interval or IPI. But basically, it's the time between one child's birth date until the next child's birth date. So for example, if my first child was born on November 4th, and then 2 years later on November 25th, my second child is born, it means their birth spacing is 2 years and 3 weeks. So there are a lot of risks associated with having children too close together, and there's risks for both the mothers and the babies. So let's go ahead and talk through those so that you know what you're getting into if you choose to have children very close together. So as a mother, these are some of the risks that you could be dealing with. The first one is depleted nutrients. So during your first pregnancy, as well as breastfeeding, you can really deplete the nutrients of folate and iron specifically. And folate is really important in the red blood cell formation and the development of healthy new cells, which is why mothers who are expecting to be pregnant or who are currently pregnant are expected to have folic acid in their diets. And you can get that by eating leafy green vegetables. But iron is another one, and that's needed for the rapid growth of the fetus when it's growing in your body. So it's really important that you start your pregnancy, your second or subsequent pregnancies off on the right note. You are at greater risk of bleeding in subsequent pregnancies if you don't allow your body time to heal. The delivery process, there can be inflammation and your body can heal itself. Sometimes medications are required for that, but you would not want to be bleeding during your second pregnancy. You can have a premature rupture of your bag of water. So babies survive in the amniotic fluid. And when that bag of waters breaks, a baby needs to be delivered generally within 24 hours of that time. But if it's prior to 38 weeks gestational age, you can be putting your child at risk. The placenta could peel away from the uterus. And while this is probably more common in older moms, ages 35 and up, it can be dangerous and life-threatening to any mom who encounters that. And then finally, increased risk of death. I think one of the beautiful things of me being a mother was being able to see my children come into the world and to watch them grow up. And if I don't take good care of myself, I could put that at risk. But there's also risk for the babies. And you think about bringing them into the world, and we want to give them the best possible start. And we can do that in one way by providing adequate birth spacing, because when we don't, The babies could be dealing with things like premature birth. So this is going to be a baby that's born before 37 weeks gestational age. Low birth weight. Obviously, if the baby isn't growing inside the mom's womb up till around 40-week mark, then yes, the baby is going to have a lower birth weight. And specifically, we're referring to babies born under 5 pounds, 8 ounces in weight. NICU admission. Obviously, if a child hasn't had time to grow to its fullest potential in the womb, there are chances that the baby may not be able to breathe and survive without the help of medical devices. Ongoing health problems. So you would be putting your baby at risk for things like asthma, developmental delays, possible vision and hearing loss. And again, all of these things that I'm discussing you can help your baby get started on a healthy note by doing birth spacing. The next risk to the baby is congenital disorders. This is things like Down syndrome, heart defects, cleft palates, things that the children, again, would have to live with for the rest of their lives. Increased risk of autism in the second born child. So autism is a neurodevelopmental disorder that causes challenges with things like communication and socializing and behavior. Again, birth spacing is what we're promoting in this entire conversation. Why not give your child the best start possible? And then finally, you also, not only is there a risk of the mother dying, but there's also risk of the baby dying. There are other challenges to having children close together in age. I think the term Irish twins may be a phrase that some of you are familiar with, and that's when you have two babies that are born in less than 12 months time frame. But we're not just talking about Irish twins. We're talking about any time where you have babies spaced really close together. Maybe if they're only 18 months apart, you would still be experiencing this. But if you think back for those mamas that are out there listening and dads that are out there listening, the feeling of exhaustion and tiredness and never ending everything. You don't get enough sleep at night. You can't stay on top of the laundry. You're always dealing with feedings, whether it's during the day, during the night, or right when you need to take a nap because your body just won't go on any further. You look at the financial implications of having twice the children. So diapers would be one example. You think about as time gets older, as time goes on, the jealousy that an older child may have. I'm a mother of two very proudly. And when my second child was born, my older daughter definitely started acting out, and I was prepared for that because she was used to being an only child, and now mom's attention had to be divided between the baby and her. And then just not enough time to concentrate on motherhood. I think it takes a little while to get the hang of motherhood and get that under your belt. So why not give yourself that grace? And then lastly, just a logistical thing. When you have two young children, that may be really hard to get a babysitter, whether it's for you to go to work, whether it's for you to take a little time for yourself or for going back to school. So those are just a couple of other things that we wanted to make sure to point out to you. But remember, the choice to have children or not have children, it's definitely a personal choice. And how many children you want to have is also a very intimate decision with you and your partner about how many children can you raise? What are you comfortable with, both physically, financially, emotionally? So it's not that we're trying to say, yes, it's better to have two or more children. We want to remind you that it is a choice, but if you choose to have more than one child, the timing of that second and third and subsequent pregnancies are very important. A conversation about birth spacing would not be complete unless we also talked about miscarriages. So whether you're losing a baby in the womb or whether you have a stillbirth, parents need time to process that, and we see this a lot. God has a plan for each of us, and the way that He spins that, we We don't know. He is ultimately in control. But if a baby is taken earlier from what we believe should be, there needs to be time to grieve, time to evaluate the risk, what may have caused that miscarriage. Are there things to prevent? Address the anxieties, the fears, the legitimate fears of, is this going to happen again? I have friends who have had numerous miscarriages, and the impact on the psyche that has does need to be addressed. And then always make sure to speak with your doctor about the timing is best. Here in a moment, like I'll share with you the general recommendations, but you are each individual with individual historical backgrounds that you bring to your pregnancy from your hereditary side, but as well as the choices that you make. And so it's really important that you talk with your doctor before starting. So when is it best to plan for and try to have your second or subsequent child? So you're going to hear 3 different answers, but there is some consistency in them. So the March of Dimes, a wonderful organization that provides us great resources, states that it's okay to start trying to get pregnant again when your baby is 18 months old. The World Health Organization recommends waiting a minimum of 2 years before having a second child. And then some of the departments of health suggest waiting between 2.5 and 3 years before that second pregnancy or third. But then we also want to put the disclaimer in there that beware that waiting too long may not be ideal. So depending on your age, depending on the physiological changes that have gone on, some mothers are going to see an increased risk of developing preeclampsia. Now, while preeclampsia is common, it's not overly helpful to the baby, and it's when the mother has high blood pressure, and generally there's associated signs that another organ system is not working properly. I believe the liver is one of those organs that can be affected. So if you're thinking about starting to try for your next pregnancy, definitely keep in mind not to try before your child is 18 months old, but also don't wait too long in that because there are other risks associated with waiting. So we're going to give you some tips on how you can plan for that next pregnancy if you're looking at having more children in your family. So first, solve any health problems that you have. Those are going to be things like if you are overweight or if you have high blood pressure, work on getting those things under control. Review the safety of the medications that you're taking. Certain medications are not good for babies, and giving your medical provider an opportunity to talk with you about that and switch you over to medications or change doses so that it can be healthy for your pregnancy. Make sure you're up to date on your immunizations. That's all immunizations. That does include the COVID vaccine, which does show promising signs that the antibodies that the mother builds up are transferred to the baby as well. Find out if you have any medical conditions that could affect your pregnancy. If you've experienced infertility in the past, that would be one thing that you would want to talk with your doctor about. If you have other things going on in your life, it's amazing how the level of stress, you may think it only impacts you, it actually impacts all of your body. And so imagine developing a life inside your body that has to live with that high stress, or if you're in an abusive relationship, the impact that could have on your future child. Make sure you're eating healthy and exercising. It's recommended that you get 150 minutes of exercise every week. So that could be going in for a walk. I mean, we've got some beautiful spring days ahead of us. It could be riding bikes with the kids. It could be doing push-ups or sit-ups every time a commercial comes on during your favorite show, but make sure and get that in. We talked earlier about the importance of folic acid, so make sure you're taking a vitamin that has that. And then you also want to make sure that you're doing everything you can to limit any outside substances to your body. So stop smoking, stop using other substances. If you are using hardcore drugs, definitely talk with the medical provider about stepping down. It can be dangerous for your body to just quit certain drugs cold turkey. And then finally, And this is sometimes a hard one for a lot of parents to remember, but remember that you cannot control when you conceive. There are ways that you can track your ovulation through natural family planning, but it ultimately is God that determines when you will conceive. So be patient, have faith, and really overall, if nothing other than these last 2 points are what you remember from the entire time with us today, it would be these two statements. So the March of Dime urges every woman to consult with a healthcare provider to select an approach to family planning and birth spacing consistent with her needs and beliefs. And then make sure to allow your body to heal between pregnancies so that your future babies have the best chance of living a healthy life. At Catholic Charities, we are honored to work with so many moms and dads and their babies and their families. And we want the best for each one of the families that we serve as well as for you. If you're interested in learning more on the topic of birth spacing, please check out any of the following websites. You can also do some great searches out there. So thank you for joining us today, and we wish you a wonderful rest of your day, and looking forward to our next session next week. Make sure and tune in next Wednesday at 2 o'clock.